Can we meet you? Your name?
Yeah, I'm Dr. Adedoku Adekunle, the Medical Director, General Hospital, Suleja, Niger State.
And the SCDC recently announced that it has been confirmed the outbreak of monkeypox. We would like you to please explain what monkeypox is.
Yeah, thank you. Monkeypox is a rare but potentially serious viral illness, and it's not as deadly as chickenpox. We know that chickenpox has been eliminated for a long time. That's why some of the younger ones does not even know what chickenpox is. But it's a flu-like disease. It's a viral infection. It always starts with fever. You have all this catarrh and what have you. So it's something that, if you look at it, it progresses to you having some enlarged lymph node. Then at times you see rashes coming out after 2 or 3 days from the face, then extend to the body. The difference again that the rashes that come from this is a bit bigger than what we normally have in chickenpox. And then the history, the background is as far back as 1958, and this one was discovered within monkey species. And they found out that these days, after some time, it was also first seen in about 1970s in the Republic of Congo in West Africa here. And since that time, it's not so prevalent. It's something that go and come back. So, but contagious level of it is that it's not as serious. It's not highly contagious like other diseases. Most time you get it through the animal. It's zoonotic infection that is through the animal, mostly monkey to human being. You can also have contact between man, but it's very rare. And how do you contact it? You contact it by fluid. Maybe what your sweat gets to that person's sweat, some of the droplets, you inhale it and what have you. So those are the best. Essentially, it's not as dangerous as chickenpox.
Okay, so what can be done to prevent it?
Yes. I think one of the things that, prevention is a lot cheaper, better than curative. And one of the things that you are doing now, and what this NCDC is doing, is the most important thing. You must make sure that you enlighten people about it. Create awareness. Let people know that this monkeypox is now within our community. Prevent yourself. People that are infected can be treated symptomatically. As I'm talking today, there is no specific drug to cure it. You treat the symptom and you give antiviral. Since it's a limited infection, it will take its course, and after time, some people will be okay. It has an incubation period of between 2 weeks or 3 weeks, thereabout. And within that incubator period, it's not contagious. It becomes contagious when you start having symptoms. And like I said earlier on, symptom is fever, you have body pain, chills and rigor, and sometimes you see people have flu-like symptoms, runny nose. At times, people have cough. So these are the symptoms. When at that stage, you can contact it from someone that's infected, and those people should be isolated and be treated.
Okay, talking about treatment, since it doesn't have cure, I don't know, is there treatment for monkeypox?
There is treatment. Treatment, you give symptomatic drugs. Okay. Like I told you, you have fever, you give analgesics. You know it's a viral infection, we give antiviral drugs. And we make sure that we limit the level of contact, the way they are going to contact it from other people. So these are the things you can do to really reduce it.
Okay.
And if the person is dehydrated, you give fluid.
Okay, so does monkeypox lead to death?
There's no disease that doesn't kill. Malaria kills more than HIV. That's what most of us don't know. If you have malaria, you say, I just have malaria. But malaria kills millions of children every year in this country. And we don't take it serious. Monkeypox does not kill as many as number of malaria deaths. So there is no disease that cannot kill. Let me be frank with you. If your immune system is not strong enough to fight it, as well as a viral infection, it can knock you down and die. If your immune system is so strong, even without much medication, you'll be fine. That's why they say it's a limited disease. It's something that after some time, your immune system will fight it and get over it. So monkeypox can kill like any other disease.
So your advice to the general public?
My advice is that we should be very, very careful with our environment. Hygiene is the main thing. Most of these contagious diseases, if you are highly hygienic, if you are someone that takes care of everything you do, you can hardly have problem with that. And once the NDCs roll out some information, please let's abide by it. I think these are the key words we need to. And peradventure, you have symptoms or your neighbor have symptoms suggestive of this, let that person seek for medical attention in any nearby hospital.
Thank you so much for your time.